Hello, everybody. Welcome to All About Acne.
Hello.
We're so excited you've joined us today, and we're going to talk all about acne today.
All
Wow,
about
look at that.
the knees of the axe.
Go ahead and in the chat box, put where you're from, where you're joining us. Throw in some emojis there. All right, let's get going. Well, first of all, I am Michael Shuey. I'm the Director of Education here at SkinScript. Thank you so much for joining us. And a little bit about me. I am a licensed esthetician and instructor. I've worked in the schools before. I also own and operate my own wellness center where I still practice. And with me today, we have Tina Buckley.
Hello, everybody. How's everybody doing? Can we do, what would be like a sun emoji? Let's do some sun. Some sun or moon, depending on your vibe. Are you feeling sunny or moony? I'm the lead educator for SkinScript. I'm also a licensed esthetician, aesthetics instructor, energy worker. I have my own practice where I see clients on the weekends, treating acne concerns. So we're really excited to be talking about acne. This is actually a really nice little kind of snapshot class and just some really good information to help you move forward in your practice.
And then we have Julie and Abby. Julie and Abby are supporting us behind the scenes on the education side. So we all make up our SkinScript education team. So let's jump on in and learn a little more about acne. So I'm sure if you've been in school, if you're out of school, you talk to many estheticians, acne can be very frustrating.
Yeah.
It's not just a one and done typically.
No.
I know there have been times in the treatment room I've been stumped and had to, ask for some advice from my colleagues. And, you ask 10 different estheticians how to treat acne, you'll probably get 10 different answers. There's just a lot going on. So we're going to try to break down some of this, and you can kind of see where it's usually not just one thing. It's a culmination of a lot of different things. And this could be sebum that has been trapped in the follicle. This can be a displacement of the P, or now we call it C, acne bacteria.
Man, I forgot to fix that C.
That's all right. We'll talk about that a little later. Impaired acid mantle, hyperkeratinization, inflammation due to disruptive of the normal process, hormones. And then, acne treatments should address multiple symptoms. And we're going to break down today different types of acne, we're going to show you some different series and ways to treat that. So hopefully next time you're in the treatment room, or if you're in school and you encounter some acne, you can have a little more knowledge to empower you and how to treat it.
I want to share something briefly because I had a really good conversation with an esthetician about this. You don't have to experience acne personally to be an expert on treating it as an esthetician. Like, don't feel that, I have never experienced acne before, therefore I don't have an understanding. That's not true. You can become educated and you can have an understanding, and you can still have empathy and hold space for your clients that are experiencing it. Just because you didn't experience it doesn't mean you can't be an expert in treating it as a licensed professional, because you can. I believe in you.
That is great advice, Tina Buckley. All right, let's do some anatomy. Yay! The pilosebaceous unit. I know everybody's out there going, oh gosh, anatomy. Here we can see the sebaceous gland. It's a lobe-like structure here, and we have this duct, and this is where the sebum is able to flow up this hair shaft there. And we have, as we can see a lot of times on our clients, in the T-zone, we're going to see a lot more pores here, and across the shoulders, and on the scalp. And the sebaceous gland, we're going to talk a little more in depth on it, is the sebocyte. And the sebocyte has a short little life cycle. So our keratinocytes have a pretty short life cycle.
Yep.
Put in the chat box, on average, what's the life cycle of a keratinocyte? But when we look at the sebocyte, they have a short life. They are 14 to 20 days. I mean, we're talking like 2, maybe 3 weeks. That is quite a short little shelf life there. So we want to make sure that they're doing their best possible. And we're going to talk a little bit about how they work and how they are instrumental in helping create different things on the surface of our skin. But when they're not working properly, what can happen and different types of acne we can see.
Yes.
All right, so here on this diagram, we can see we have some different things. Let's see if my little pointer works today. Yay, look at
Oh,
that.
nice.
So here we have our dermal epidermal junction. So above this, we have our epidermis, and below we have our dermis. And over here, we have our follicle. So here's our follicle. And down here, we have our sebocytes here. And the sebocytes, their job is to make sebum. So think of that. That is their whole job. They're our holocrine gland. I can't speak this morning. Holocrine gland. And their whole job is to basically make sebum. That's what they do. And then after that 14 days, 20-day cell cycle, they literally burst open and they release their content. And so when that sebum is released, then it should flow right up here. And so sebum hopefully should be high quality. But occasionally what can happen is if these little cells, and these are cells, and if you've ever listened to Tina and I teach, we talk a lot about cell membrane.
Mm-hmm.
And cell membranes have to be healthy. If we have healthy cell membranes, then things can pass into the cells, nutrients can come in so that the cell can function properly, the cell can get rid of waste. But if these little sebocytes are not healthy, if they don't have healthy cell membranes, then they may not create high quality sebum. And this can create a lot of cellular debris. So if I have this little cell here, and it should kind of basically explode and release sebum, but then you're also going to have the contents of the cell membrane. And think of that as kind of almost could be chunky. If I have poor quality sebum that's thick, plus I have a lot of cellular debris, that can almost like clog this up just like a dam, and start to get thick in there, and things aren't going to flow properly. And we're going to see a little later how that can start to cause a lot of different issues. And when we're looking at the process of how our acid mantle is created, on this slide, we can see here that our sebocyte should release this sebum, which is made up of triglycerides. The triglycerides should flow up to the surface of the skin where they meet this little cute C. acne bacterium, the Cutium bacterium, formerly known as the P. acne. And that's why you see P. acne also on there. But Cutium bacterium or C. acne bacteria, this is the bacteria that is going to live on the surface of our skin. And it's going to ingest these triglycerides here, and it's going to spit out free fatty acids. The free fatty acids are going to create our acid mantle with a pH of 4.5 to 5.5. We should know this number right here, that the acid mantle should be 4.5 to 5.5.
Not 7.
Not 7. It's not Dove bar soap.
Nope.
So these little C. acne bacteria are how we get our acid mantle created. So we need them on the surface here. So again, just to recap, these little sebocytes release the triglyceride. This triglyceride should flow up to the surface. It meets the little bacteria. The bacteria munch on it, num, 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 num. They eat it. They spit out free fatty acids, which creates our acid mantle. Now, that is normally what happens when everything is going smoothly. But what happens when things aren't going smoothly?
Chaos, as we can see. So we know that the surface of the skin is this unique ecosystem with the acid mantle, and the P. acne bacteria or C. acne bacteria are pretty much like benign bacteria. They can help prevent, other types of microbes from invading, et cetera, but they can become an opportunistic pathogen in this sense, to where if their food source is obstructed or impaired. So we're going to look at the follicular lining of the hair follicle of that pilosebaceous unit, and it should have a pH of about 7. So it's a little bit more neutral down in the follicle and more acidic on the acid mantle. So what can happen is the sebocyte perhaps is creating poor quality sebum, where instead of being free flowing, it's a little bit more like margarine or like room temperature butter, where it's there, but it's definitely not flowing to the surface. So you have the bacteria on the surface of the skin getting hangry. Who's been hangry before? Let's do an angry face emoji if you've been hangry, or a happy face if you're eating currently right now as you're watching this presentation.
The beauty of watching it on Zoom.
Everyone have a little snack. But what will end up happening is this bacteria will become hungry and it will go searching for its food source. So since the oil isn't flowing up, or the sebum isn't flowing up to the surface of the skin to be met by the bacteria will go look for it. So it's going to look for it in the follicle. So if you've been taught the bacteria goes into the follicle, yes, it does. It'll go into the follicle following its food source and start, crunching and munching on the sebum in whatever capacity it is, if it's fluid, if it's not. And what will end up happening is that this particular bacteria will start ingesting our sebum within the follicle as it metabolizes and releases a byproduct of free fatty acids within the follicle. Those acids have a pH of 4.5 to 5.5, where the follicle is a pH of 7. So you're going to create inflammation by creating a more acidic environment within the follicle. So these particular bacteria are going to start populating in the follicle, feeding on sebaceous matter. So it's going to create these papules. So the papules are going to be inflammation. They're going to be pink. They're going to be red. They're going to be sensitive to the touch. They do not, contain any pus. So they're not pustules, but they can definitely turn into them. So kind of a bummer with papules. They're more painful. But this is kind of a twofer where you have all of that energy being spent into the follicle. You're kind of missing the ecosystem aspect with the bacteria on the surface of the skin to create the acid mantle. So not only do you have inflammation within the follicles, you also have impaired barrier function. So you have impaired acid mantle. So this picture here we've had for years in our classes because this is a great visual for not only acne and papular acne. There is some pustules there, but for the most part, it's impaired acid mantle. Do we think this particular individual here in the photo is being kind to their skin?
No.
Do you think they're, being nutritious and nourishing and soothing? No, they're probably hitting it with everything they got to help eliminate bacteria, when in fact, we just have displaced bacteria and need to focus on the health of the sebum and the sebum quality. So papular acne is displaced bacteria. So you're dealing with two factors here. So that's why when we talk about you want to treat multiple symptoms, you do want to treat bacteria, but you also want to treat impaired barrier when you're treating papular acne. So this is an inflammatory form of acne. It's where you have the bacteria converting triglycerides into free fatty acids within the follicle and not on the surface of the skin, which is going to increase inflammation. They do not come to a head, so please don't squeeze these. Spot treat. We have a great spot treatment that's going to be amazing for these. Please don't squeeze, or you're going to damage collagen and you can get some acne scarring. This is an example. There's a picture of some papular acne scars. These are very different than pustular. So do not squeeze the papules. Don't do it.
Please don't squeeze.
Don't squeeze. Don't squeeze. I also want to share something else that's kind of cool about bacteria. I learned recently that bacteria in some cases with more aggressive types of acne create something called a biofilm. And a biofilm is like this extracellular slime that they can encase in themselves, or they become clusters that are difficult to fight because it's like a survival mechanism for them. So when you start really kind of hammering away with really strong antibiotics or really strong acne treatments, that they can actually build up a resistance due to this biofilm. So having particular ingredients, and we're going to discuss it, that can help disrupt the biofilm to help eliminate the bacteria. It's like good girl gone bad with the bacteria. This can really, really help reduce the type of inflammation and the population of the bacteria in the follicle. So papular acne is very tricky, but also because you have to treat the skin sensitive. We love this 6-week series for papular acne. It boasts the coconut papaya enzyme, which is beautiful. So if you also have a client that's a little extra sensitive in papular, you can definitely buffer the coconut papaya enzyme with the goji berry yogurt mask, which is a favorite here. So these are a treatment that for impaired barrier and papular acne, so your multifactorial type of treatment, 2 to 4 weeks apart, depending on sensitivity. And also these can be 30-minute treatments where the enzyme treatment is just going to be the highlight. So double cleanse, tone, coconut papaya enzyme for 7 to 10 minutes with or without steam, remove, and then finishing product. So this is going to be more of a reconditioning of the skin, a retraining, a refresh, a reboot, to help tackle this type of acne treatment. Is anyone surprised that we're not hitting it a little bit harder? It makes sense that we're not, piling on a bunch of acid or anything like that to exfoliate. We really are working on treating the barrier and helping to exfoliate the skin. So we have some home care recommendations. Like to point out for the home care recommendations, they don't have to use all of this. These are just products that we recommend as a company to help clients with papular acne and sensitive skin, because papular pustular rosacea will also benefit from this type of treatment.
So if we have too much buildup of dead skin, we're going to see hyperkeratinized skin. And this is where it can look like closed comedones. It could look like a pustule, a cap of skin basically over that follicle. We said we want that oil to flow up to the surface, but if it's trapped and there is dead skin there, that's going to start to cause some issues. So when we have buildup of dead skin cells, usually the number one culprit of that is we're not getting adequate desquamation, meaning our skin is not naturally shedding off as it should. It's building up. And if we get buildup of that, not only could we see it as acne, but we can see it as fine lines and just the skin looking dull and also very textured. So this is because there's usually a lack of free water. The skin's dehydrated. And so hydration is a key component, especially with the skin naturally desquamating. We need to activate those enzymes, the protease and glycosidase, to help break up that dead skin. Mm-hmm. So when we see a type of client like this, a lot of times, again, what do we want to do? We want to attack it. And most clients are going to overstrip and over dry out their skin. That's what they're doing. They might be using harsh products at this point, and they're really just overdoing it. This was me growing up as a kid. I had really bad acne, but I also used bar soap. That was very stripping and drying to my skin. Oh, I didn't know.
No, I know.
It was the 90s. It was a different time.
It was the 90s.
It was a different time.
It was the 90s.
But I also then would use things like I'd use a ton of benzoyl peroxide, Stridex, Clearasil.
Yeah.
All these things that just overstripped my skin. Yeah. So, and I never used moisturizer. So I was very dehydrated. My skin wasn't naturally turning over. So I was getting a lot of these caps over there, which was collectively just starting the process and creating a lot of problems. This also can affect our epidermal bilayers. If I don't have that healthy bilayer, that natural kind of oil layer, that is going to lead to a lot of transepidermal water loss, which again, with dehydration. So when you see your clients having a lot of texture like this, we want to talk and have that conversation. What are they doing to their skin? They're usually going to overstrip it, under moisturize it. So we need to talk about the importance of balancing out. And then from there, looking at, are they overdoing it? So if they're overdoing it, let's back off. Let's increase some hydration. And that's also internal hydration too. So maybe looking at their intake form, what's their water intake like? Or are they, just drinking coffee, energy drinks, soda all the time? Mm-hmm. So we want to look internally hydration, but also topically hydrating the skin.
I want to touch a little bit on benzoyl peroxide because we know that this is a very common acne ingredient. And for good measure, too, use wisely, because it is dehydrating superficially for the skin, and the skin needs to be hydrated to be healthy. So what does benzoyl peroxide do? Benzoyl peroxide actually generates free radicals. So it's generating and releasing free oxygen radicals into the skin. And since bacteria is anaerobic, it can't survive in an oxygen-rich environment. It helps to kill bacteria, which is amazing. But what happens a lot, especially with benzoyl peroxide, it just gets abused. So just make sure, more is not better when it comes to servicing the skin, especially when dealing with acne and bacteria. You have to be strategic because remember, I mentioned those biofilms. Bacteria wants to live.
I want to live.
I want to live. So we have to remember layering products, and being really mindful about the treatments that we want to utilize are going to be critical. So the benzoyl peroxide's fabulous, but just be mindful of how often and how much you're using it, because it could turn into something such as hyperkeratinization, which is really annoying for me. I know exactly when my skin is going through this.
And you'll be able to see that when you do your thorough skin analysis on your clients. So point it out to them, have that conversation. And if they're overdoing it, let them understand why more is not always better. So we love a series of 6. The reason we love a series of 6, these are spaced out 1 week apart, is we are hitting a cell cycle and then a little extra there. And so these are little boot camp treatments. As Tina said, these can be very quick treatments. They can be kind of condensed down to maybe a 30-minute. And that allows your client to maybe afford it a little more and a little less time, because we're asking them to come in 1 week apart for 6 weeks.
This is a rad treatment, by the way.
So if I've got a lot of buildup of dead skin cells, if I have closed comedones, this is a phenomenal treatment. You're going to see here we're utilizing our glycolic peel with a light microderm or dermophile. Now, I want to clarify this. Light microderm, 1 pass, low PSI.
That's what I always say.
We're not going in and we're not, just blasting the skin here.
Don't turn it into a meme.
You'll see in treatment 1, you could do a glycolic peel, or you could also use an enzyme. If we're just starting off with a client, we may want to work them up to a glycolic peel, but we could just stick to some of our enzymes that we're going to discuss here in just a little bit.
Totally.
Do the enzyme first, let that soften the skin, and then go and buff with the microderm. A dermophile, if you're not familiar with dermophiles, they are a little disc that have a little diamond encrusted tip on them. You can use it as a manual exfoliation on the skin. It's really nice alternative to microderm. It doesn't have the suction, so if you have somebody with telangiectasia, it's not going to make that any worse. But you can see here, we're doing these glycolic peels. Now, if you're not familiar with our glycolic peel, it's a very progressive peel, and you can do those 1 week apart. Usually you have minimal downtime with that. If you're not familiar how to do our glycolic peels, we have a lot of resources. You can go online into the your PDF training manual. You can find how to do it there. In our learning center, we have a full chemical peel class you can take. You can come to Phoenix and you can spend a day with Tina and hands-on training with our chemical peel class.
We highly recommend taking one of our peel classes, or you can even just talk to us about the peel classes, because our peels are very different.
So get comfortable with doing peels, but this is a phenomenal protocol. You are not going to always see a ton of change in the first 1, 2, and 3rd treatment. You're really going to see once you hit that cell cycle and you start to hit treatments 4, 5, and 6, that's when you're going to really notice some shifts and changes, because you've worked with 1 full cell cycle. Now you're working with new fresh skin here. So you can also see home care, and as Tina said, you don't have to use all of this. This is just some suggestions of some products that are really beneficial when you're treating acne.
Love a series. Love a series. Love this picture.
Oh, look at that picture.
Yeah. So these are impactions. These are open comedones, blackheads. Yes, we found this off the internet, because you can find anything on the World Wide Web. World Wide Web. Anyone remember that? WWW?
Is there a comedone extractor emoji?
Oh my gosh, there should be. I think this should just be like one of the, like a bomb emoji. A bomb and then an exploding bomb emoji. But blackheads are kind of interesting, because these are another non-inflammatory form of acne. So closed comedones and open comedones are traditionally non-inflammatory. However, they can become inflamed when there's a local infection. But for the most part, these are going to be stable, non-inflammatory, and can often take a long time to clear because they have taken a long time to build.
I find these are the most difficult sometimes, because clients, they're so visible to clients, and the client just wants them gone.
Yeah.
But like you said, in one treatment, you may probably not be able to get rid of those. So it can be very frustrating to the client, because they're like, well, just extract it. But how long has it been there?
Yeah. And then do we want to scar them, with extracting? Because I've seen some extractions online and they look incredibly painful. In fact, I've had many conversations with clients where extractions are just so painful that they rather just try to work a way around that. But sometimes you can't. But however, you can prep the skin. So the key to skincare for this form of acne is consistency. Now, you can have a client that cleanses all the time. You can have a client, for many different things with open comedones, but exfoliation and hydration are going to be very important. So the health of the sebocyte and that skin or the cell that produces sebum, the quality of the sebum that's being produced is going to be important. And also you can see this in younger clients as well because of cell turnover rates are going to be dramatically faster than that of an adult. So 14 to 19 days is the typical teenager cell turnover rate. So you're getting lots of cellular debris, perhaps poor diet, lack of hydration, you're going to have some impactions. So some enzymes that we have available, all of our enzymes are actually going to help with impactions. I'm able to do extractions with any of the treatments that we're able to do with enzymes. However, we have 3 that can boast the best results and also be multifactorial in treating different types of acne as well, on top of just blackheads or open comedones. So the coconut papaya enzyme is amazing for sensitive skin types. So you have a client that has blackheads, but they have rosacea, sensitive skin, normal skin. Maybe they have a little bit of papule here and there, or they're just sensitive in general with some open comedones. The coconut papaya enzyme is going to be amazing for them. If you have a client that is dealing with closed and open comedones, the blueberry enzyme is going to be fantastic because you have the glycolic acid and the salicylic acid in there to work superficially and within the follicle to help dissolve oil, kill bacteria, reduce inflammation, and help dissolve any types of caps of skin that are keeping impactions in the follicle. So blueberry enzyme's awesome. It does turn people flush. So if you've ever used the blueberry enzyme, put a blueberry emoji out there because that is fantastic. I miss that if I'm ever out. Sometimes I think I'm like, oh yeah, I have enough, and then I don't. I'm really bummed.
It's one of my favorites.
And then we have the pomegranate enzyme, which is very special because it's going to deal with closed comedones, open comedones, and also going to deal with hyperpigmentation. So post-inflammatory hyperpigmentation that can happen with acne as well. So this has lactic acid, which is going to be a hydrating acid, exfoliating, great for texture and closed comedones, pustules, and then salicylic acid for that pore refinement. So, but the pomegranate enzyme is going to be the strongest. So if you were to go like in an attitude of strength, coconut papaya for your sensitive, your blueberry enzyme is going to be for more normal skin types. If they're a little bit more sensitive, maybe you could buffer the blueberry enzyme to get those benefits. But the pomegranate enzyme is going to pack the most punch. It's going to have the most heat and have the most impact because of that 2% sal that's in there too. So these enzymes are amazing and what we recommend for blackheads. However, our other enzymes as well have fruit enzymes to help soften sebum, which are great for extractions, but these tend to be the top 3. We have our series of 6. This is our oily blackhead treatment series. You'll notice you can start off with coconut or blueberry, and if you're familiar with our buffering technique, you can always buffer too. I have colleagues that only buffer, which is amazing. But you can utilize coconut or blueberry and then for the first treatment, and then for the additional treatments, blueberry or pomegranate. So why would you choose blueberry or pomegranate? Pomegranate, if they have a little bit more resilient skin and they're dealing with hyperpigmentation, that would be epic. We have an optional layer of the retinol scrub. This is going to help facilitate even greater desquamation within the follicle to help release impactions. It also adds a little bit of physical exfoliation to the skin to kind of prep. So if you're curious about the layering aspect, we do talk about this in our PK online in the Learning Center. So check out that video because it's awesome. There's a little video of Michael. It's amazing. And do some extractions. So, and also be mindful too, space out your extractions. Don't feel like you have to extract everything all at once. Oftentimes clients want extractions, but they don't want to leave looking swollen and holy. So really be mindful and pick spaces and kind of work through the face, especially if you're seeing them a week apart. Try to minimize the extractions to sections or areas so that way your client isn't just left swollen with extractions everywhere, because not everything may be released within the first or second treatment. Maybe the fourth, fifth, and sixth treatment, you'll get more benefits from that. So the home care recommendations we have here, and then of course the above protocol could be modified for a sensitive or younger client. Let's say that they're a younger teenager, with coconut enzyme and seen every week to help with blackheads and extractions and impactions. Be fantastic. Has anyone tried this series before? This one I find to be the most relatable and the greatest modifications that you can make. Or has anyone utilized the retinol scrub to layer? It's so good.
Such a good trick. Ooh, pustular acne.
I know. Who's having lunch now?
So this is an inflammatory skin condition. So we might have a closed comedone. We have that dead skin trapping that pore. We've got that bacteria now that has gone looking for its food source. It's down there in the follicle, and it's just munching away, and it's spitting out those free fatty acids. It's changing. The pH is down there, and the body is going, the immune system at some point is going to start to send white blood cells to fight this inflammation. So when we get this pus, as we can see there on that bottom picture, how many of you just want to pop that, right?
So bad.
But we don't want
in your car.
And
then touch the steering wheel, and then touch your face again.
I always tell the story when I was probably 16.
Oh,
Tina
this
loves
story
this story.
is so,
so
man,
gross,
it's so triggering.
I think it's what
Trigger
made me
warning.
want to be an esthetician.
Trigger warning.
I was probably like 16. I was out at the grocery store with my aunt, and I had probably on my face what you can see on that bottom picture there. And my aunt walks up in the grocery store. Her hands had been all over the cart and everywhere. And she just walks up and she pops it. And then just turns and walks away. And when I think of that now, knowing what I know, it skeeves me out at that point. But that's what we don't want to do here. So we have this.
Enjoy your travels.
Yay. Hope you're not eating. So we have this bacteria in there now, and the body is trying to basically fight it. So we're getting this pus, and the pus is basically a mixture of dead white blood cells and the bacteria cellular debris. So the reason we don't want to pop this so much is because we don't want to spread that, if we have active infection going on. So especially if it's a different color, if it's green, so just be very careful with that. And so when we have this going on, let's teach our clients not to pop, because if we've got clients who are pickers, I know that can be one of the most frustrating things in the world. I used to be a picker, so I understand. I think that most of us were probably pickers. That's why we love to do it.
Maybe some of us are still. Any brave hand emojis? No.
But when we're dealing with this, we want to make sure that we're not popping it, we're not spreading that bacteria and making it worse at this point. So when we're looking at our treatments here, you can see we can start off with, again, our enzymes. We could use that blueberry enzyme. You could use the pomegranate if you like too. And we're going to start that way. That's going to help start to break up some of that, dead skin there a little bit, that cap. But we're going to look at our second treatment here is our cranberry turnover peel. This is our 20% salicylic peel. If you've never utilized this peel, it is spicy. It is quite powerful, but it's also phenomenal for treating pustular acne. Again, if you don't know how to utilize this or any of our other peels, check out our peel class, come down to Phoenix and spend a day with Tina in our peel hands-on class, which is amazing, or look at your protocol manuals. But this is a spot treatment, and we're going to just dot it in those areas. We're not going to put it all over. We're just going to spot treat that area. And then you can also we have our alpha beta protocol that is in your pro guide in your training manual, and you'll see that in treatment 3. That is where you're going to do a glycolic peel. You're going to follow the protocol. You're going to do the peel. You're going to completely neutralize it. And then you're going to go back to those pustular acne and you're going to spot treat it with the cranberry. This is a beautiful, beautiful treatment. It is quite active and quite spicy, so you really want to make sure you know what you're doing properly. And you can go back and you can use that cranberry as a spot treater there. That salicylic is really going to go in and kind of help dry everything out, heal everything up. So you can see this is going to be really spaced, determined by the esthetician. The cranberry turnover peel can cause flaking and peeling, and we don't want to peeling skin. So we might want to space this out, 2 to 3 weeks, depending on where we're treating, or maybe we're just treating certain sections as the client's coming in. You can always go back and use those blueberry enzymes if the glycolic peel is going to be a little much for your client. So again, you have flexibility. We really give you these treatment options to help you think about different ways that you can achieve this. You don't have to do it exactly how it says there. Once you know your products, once you know what kind of acne you're dealing with, that is where you are empowered to go, okay, I know what I'm dealing with, and you can adjust, because you are going to have to adjust some of these series. If your client comes back and they're completely flaking and peeling, then we're probably going to have to do a hydration facial instead. So again, you've got your home care down there, and these home cares can be adjusted based on your client and what your client is presenting with.
Modify, modify, modify. We give you the maximum you can do, so don't do more than what we suggest, but you can definitely do less than what we suggest.
Do what you're comfortable with.
Because the skin's always evolving. The skin is moody. If you've taken a class, the skin is moody. One day it's great. The next day, maybe not. Maybe it just needs a Wendy's chocolate frosty. That worked its way in. That was perfect. Anyone like Wendy's chocolate frosty? I had one for the first time like 2 weeks ago. Anyway, I digress. But fungal acne, yay! Not yay as in like we love it, but yay as in let's talk about it. So fungal acne and regular acne. Fungal acne does exist, and very, very happy that we're able to have these conversations and get some information available to you about fungal acne and treatments that are available for it. But let's compare first. So fungal acne versus, like, for lack of a better word, just regular acne, bacterial acne. Let's go through. So I want to go through, let's talk about things they have in common. So they're both going to be infections in the hair follicle. Yes. Inflammation is going to be present in both. Yes. Unfortunately, it is possible to have both at the same time, and we'll talk about that a little bit later. And also something that's unique about fungal acne and not regular acne is fungal acne can be spread through close contact. So being a very hygienic individual and also a very hygienic esthetician is going to be critical if you're treating clients with fungal acne, or at least supporting clients that have fungal acne. So fungal acne is caused by a yeast-like fungus called Malassezia. Malassezia is also responsible for seborrheic dermatitis or dandruff. So if you have any loved ones that are experiencing dandruff, either on the scalp or in the beard, this Malassezia, this yeast is its person. And Tinea versicolor, which is a unique condition as well that looks like hypopigmentation, but it's not. Medically, it's referred to as Pityrosporum folliculitis or Malassezia folliculitis. So infection in the hair follicle, yes. Itchy and inflammation. If you see the difference here, fungal acne is going to be itchy. Regular acne is not going to be itchy. So that is one question that you can ask your clients when they're experiencing acne. If it's a virtual consultation and you haven't seen them yet, or even in the treatment room as you see them, they can both be inflammation. They can both, look like pustules, but a good question to ask would be, is it itchy? And then also you can look in a skin analysis if the lesions tend to be uniform, being exactly or very close to the same size and shape. Fungal acne tends to be very uniform in the way it presents itself, where regular acne from P. acne bacteria, C. acne bacteria, they can really vary in size and shape and location. Fungal acne is going to be less common, and severe cases can take longer to resolve. And fungal acne does appear on the face. It's usually more common locations are going to be the forehead, along the hairline, especially around the temples. But fungal acne also can occur on the body. I, unfortunately, during COVID, which was a wonderful time in 2020, got this on my abdomen. I had no idea what it was. It was very, very itchy, but luckily I went to urgent care and got medicine and it cleared up like really fast, like just got annihilated with antifungal medication. But I had no idea what it was because it looked familiar, but it wasn't. So regular acne is caused by bacteria. So if you or your client feel like they're experiencing fungal acne and they're like, well, I'm going to go to the dermatologist and I'm going to get some antibiotics. Antibiotics don't work on fungal acne, but antibiotics will work on regular acne, topical and oral. Regular acne is referred to as pustules, papules, closed comedones, and open comedones, the kind we just discussed in detail. It will show up as an infection in the hair follicle, not going to be itchy, but inflamed. Lesions can vary and it's going to be more common. So let's talk about how fungal acne can be caused. So yeast multiplies in hot, humid environments. So anyone ever make those rolls, like those frozen rolls, where you have to like cover them with cellophane because they're yeast rolls, right? Have you ever done that, Michael?
I have.
Where you bake bread and you have to have them insulated a little bit.
Yep.
So they grow. So they rise. So yeast multiplies in hot, humid environments. So if you live in a location, does this look like Nick Jonas?
Now I want bread.
I know. I was thinking like those rolls. I can't remember the type of rolls. Skincare and food. It doesn't matter if we're talking about acne. We're going to talk about something. But if you're living in a more humid environment, perhaps this could be a factor for you. Perspiration and heat, hot yoga, workouts, gyms, anything like that. Steam rooms, anything like that. Any type of autoimmune diseases or immunosuppression therapies can increase because you're messing with the microbiome of the body and of the skin. Any recent prescription antibiotic or steroid use. So what are antibiotics usually prescribed for? They are prescribed for acne vulgaris or acne in general, like bacterial acne. So in some cases, if you're using an antibiotic, that can increase the malassezia on the skin because you're preventing bacteria that usually will keep it in check and is proliferating, or steroid use, which is common for clients that have more, let's say like type of dermatitis, itchiness, sensitivities, or even with rosacea. So excessive sweating, poor personal hygiene. This would just mean not cleansing regularly, perhaps not cleansing the towels, sheets, pillows, washcloths, anything like that. And also check the diet high in sugar, carbohydrates. So if clients are more prone to candida or have experienced candida, they may be more prone to fungal acne as well. You need to watch and make sure with their carbohydrate or even sometimes their dairy intake. So some solutions, some treatment options. If you have a client that's, wanting to find something that's going to help, superficially, sulfur is a great antifungal. We don't have anything that contains sulfur, but sulfur is an ingredient that's a great antifungal and antibacterial and keratolytic, which is going to be exfoliating. Salicylic acid holds a lot of charm with being antifungal, antibacterial, anti-inflammatory, and exfoliating. However, these can maybe manage it, but to get rid of it because you have a fungal infection, perhaps medications and specialized products are going to be your best bet to eliminate it rapidly. Oftentimes people won't go and get a prescription for this, but it's critical in helping to relieve these symptoms and keep it from spreading to see a physician. So prescription medications, and I'm speaking from personal experience, I tried every holistic topical, acupuncture, herbs, everything. It did not go away. As soon as I went to urgent care and got a topical ketoconazole cream, it went away in probably like 4 days. It happened really fast. So prescription medications can be oral and topical. The fluconazole, itraconazole, and ketoconazole, which is probably the most popular. They also have specialized products that you can get over the counter, such as a 1% ketoconazole like body wash or shampoo. And then, of course, zinc and the selenium sulfide or the zinc pyrethone.
All the hard words today.
I'm like pyrethone. Those probably look very familiar to you, or if you've had clients or read some Reddits about people washing their face with Head and Shoulders and or Selsun Blue, because you're dealing with the same type of yeast that causes dandruff that's causing fungal acne. But definitely recommend getting the OTC ketoconazole body washes. Those are fantastic. And those can also help prevent as well. Lifestyle changes, if applicable, avoid excess sweating in humid environments. So if you find yourself dealing with fungal acne and you're in humid places, or perhaps you're an instructor, a hot yoga instructor, something like that, take the time and reflect. If you can't, if you live in a humid environment, I'd be like, move to Arizona, but the summers are really, really gnarly. Watch your diet. Sugar, carbohydrates, especially if you're prone to candida. Practice proper hygiene. Remember to cleanse the skin regularly. Use clean towels. Hand sanitizers right now have become really fancy, more than I've ever seen in my life, which is really awesome. So just always make sure that you're not touching your face, and all that good stuff. And if push comes to shove, I have recommended this to multiple individuals. Get a diagnosis from a derm or a physician using a swab or skin sample to test for fungus and yeast to be certain. So you can request a sample. They can look under a microscope on a slide and see if it's fungus versus bacteria, so you can get proper treatment. So advocate for yourself to get that skin sample or that swab to make sure if it's Malassezia or if it's the acne bacteria or another type of bacteria on the skin, so you can get the proper treatment. Because fungal acne, if it's not treated, will last forever, and it'll be really, really frustrating. And you always want to be careful and be mindful. Like as estheticians, we can help manage, but we cannot cure. There is places where we can support them, but if push comes to shove, man, fungal acne is very, very itchy. So we have some solutions for fungal acne support. Now, this is to help manage, or if your client is more susceptible to getting fungal acne, they work in a humid environment, they go to the gym, anything like that. These products are going to help keep the skin clean and hydrated. So cleansing, treating, brightening, and hydrate. We always love to brighten here at SkinScript. So these are some products that contain, you'll see the teal label, some products that contain salicylic acid. And then some products are going to help exfoliate the skin and help brighten and, of course, hydrate appropriately with the light aloe. So these are some recommendation we have to manage or to help keep the skin clean and perhaps prevent future breakouts.
So acne and food. When your client comes in, look at their consultation to have a dialogue about food, because their diet could be influencing this. Now, can we change our client's diet? No, but we can educate our client on maybe what foods are doing for them. And on the next two slides, we're going to show some foods that can possibly cause more inflammation in the body, and inflammation can be correlated with acne. And so the foods that are going to have a lot of inflammation are going to be very low in fiber and high in sugar. And we'll see on the next slide those foods, because when we ingest food, it's broken down. And if it is going to increase our blood sugar at a very fast rate, because maybe it's processed, it's a lot of sugar, we don't have that fiber to help combat it, that can cause inflammation in the body. But we're going to show on the second slide foods that are going to be a little higher in fiber, a little less in sugar, might have a little more omega-3s in there. And this is just information that you can give to your clients, but you can have a dialogue with them to find out, maybe what are some of the triggers that are causing this. So this is from Dr. Pericone's The Clear Skin Prescription. And you're going to see up here a bunch of different foods. A lot of these foods are processed. A lot of these foods are high in carbohydrates. And when you eat them, it is going to cause a huge spike in your insulin. And when we get a huge insulin spike, that can cause inflammation in the body. So when we're looking at this, you're going to see things like bananas. Are bananas bad? No, they're not bad. But if you're eating a ton of bananas, that's a lot of sugar, and so a lot of processed foods here, pizza, we're looking at breads, we're looking at starches, rice, waffles. I mean, French fries, yum. Now I'm getting hungry. This is all the stuff that we like, right? So is our client going to stop eating all of this? No, probably not. But if you can give them a little information on this, they can start to make choices. Maybe they're going to decide instead of having French fries, they're going to do a side salad. Maybe they can balance the 80-20 rule. If you're, the 80-20 rule, you want to try to eat, clean 80%, about 20%. It's like when you take away a food from somebody, if I said, Tina, you can never have a Wendy's chocolate frosty again.
Bye.
I'd
be done.
She's only had one before, but now
I've only had one.
She wants. So these are going to be the foods that we want to kind of limit and we want to think about. Now, on the side here, these are going to be the anti-inflammatory foods. We're going to see a lot of vegetables here.
I like a lot of these foods.
We're going to see high omega-3s, like with flaxseed oil. And these are the ones that we want to kind of incorporate a little bit more into. This would be more on the 80% that we're looking at. And so having this conversation, you could even have a printout of this, for your clients. You could say, which ones of these do you eat more of? And so if the client ultimately has a lot of acne, it comes down to their choice. I always say we're here to assist people if they want to heal their skin. We can't do it for them, but giving them information. And that's the best you can do. You can educate, give them information, and then they get to make that choice whether they want to move forward and make changes in their diet.
So some additional acne therapies. These are very common just in the aesthetics industry, in the skincare industry, to help with clients with acne. So remember, acne is like an umbrella term. There's different forms and there's different grades, and we want to make sure that we're utilizing products and modalities and even prescriptions from physicians that are appropriate for the type of acne that they have. So blue light therapy is huge right now. What's amazing with blue light, it's a specific wavelength of light that destroys the P. acne bacteria, C. acne bacteria, which in turn decreases the levels of fatty acids in the skin and the cytokines, resulting in reduced inflammation. So blue light therapy is something that is very popular and very positive right now. Sulfur, like we mentioned before, can kill bacteria and reduce inflammation and act as an antioxidant. We have benzoyl peroxide, which is amazing, which helps to influence oxygen within the skin. Azelaic acid is unique because it does help to kill bacteria and reduce inflammation, but it also is a tyrosinase inhibitor, so this is going to be a potent skin brightener and also an inhibitor of 5-alpha reductase, which is the type of enzyme that helps to increase oil production within the skin. Some common antibiotics, these you get from a doctor. Internal and topical, so metronidazole, tetracycline, erythromycin, and clindamycin are common prescription antibiotics for clients that have acne. You have Retin-A, which is a prescription tretinoin or retinoic acid. So Retin-A is a brand name. So this is going to help with acne and aging and pigmentation. So tretinoin is amazing. It's a type of retinoid. And of course, there's Accutane. So Accutane is a brand name of isotretinoin, but Accutane actually no longer exists. But we still utilize the term Accutane because I feel like people understand what that is when we say it. But technically, everything's referred to as isotretinoin now, which is an internal retinoic acid. The dose is typically 5 to 6 months. It varies on the client. It's prescribed for cystic acne and persistent cystic acne. The side effects are very dry skin that will be probably throughout the rest of their lives. So those that have been through Accutane once, maybe twice, are going to have very dry skin moving forward. Accutane is also processed through the liver, so you can get some inflammation of the liver. Birth effects post 3 months, and mental depression. So Accutane is really hard on the body. It's successful in some cases to help treat because it's going to help regulate oil production and if not annihilate oil production altogether, resulting in severely dry skin. So isotretinoin, antibiotics, azelaic acid, BPO, sulfur, and blue light therapy are some additional acne therapies that you will see clients utilizing. So always check out your intake forms. Find out what your clients are using prescription-wise and also any other additional therapies that can help. Acne support lifestyle, just like anything, stress can influence the uptake of acne and acne symptoms and acne treatment or just acne inflammation. So reducing stress by meditation, ground yourself, feet in grass, go to the beach, go for a hike, anything to where you can lower your cortisol levels are going to be great. So lowering those spikes and increasing endorphins. Cleaning up your diet, refer to a nutritionist. There's lots of access to really good nutritionists in your space. Get a hold of them and maybe you can have a working relationship with a nutritionist. The inflammatory and anti-inflammatory food list is going to be awesome too. Hormones, balancing your hormones. You can see a physician for support to get your hormones in check. Exercise is also really awesome to help release those endorphins or enkephalins and leads to really good food choices as well. Make sure you get enough sleep. Recently been reading a lot more about sleep and lack of sleep in this country, how we don't really value sleep. We value the hustle more than rest. We need to rest.
Oh, I value sleep.
We need to rest. So make sure if your clients are working a high stress job or they travel a lot, that they're taking time to rest and rejuvenate. Stay hydrated 100%. Water is your friend when it comes to any type of skin health and skincare, and also to be kind. Oftentimes, and you probably experience this too, oftentimes you have clients that like come into your room and they're like, I'm so ugly, or this and this, or I'm gross, and they're not gross. They're just experiencing a breakout and inflammation, and we can help them. So remind your clients to be kind to themselves as they go through treatments because clients that tend to have acne and acne breakouts really, really are hard on themselves. And they shouldn't be. We should hold that space. Critical thinking. So when you're an esthetician, or especially a solo practitioner, you have to make those judgments for yourself and the treatments that are going to work best for your client. So it's critical that Michael and myself and the Skin Script community, we can give you the best information we can about our products to utilize so you can make informed decisions about what types of treatments are going to fit your clients best, because you guys know your clients better than we do, but we want to give you as much information as possible with our peels, our enzymes, our retail products so you can support any concerns that your clients may have. So you want to make sure the information resonates with you. If it doesn't resonate with you, that's okay. We always want to find information that helps us, not hurts us. You want to understand the outcomes. So your client is the variable. Products are pretty consistent in their formulations and their intentions, but the skin is moody. So maybe 1 week, the client does really, really well with the blueberry. The next week, the client doesn't do so well with the blueberry. The blueberry enzyme didn't change, just the client's skin had changed in that particular week. So always be mindful of experience and expectations with the skin. Love this. Don't assume everything you hear and read is gospel. We're giving you the best information that we have with the knowledge that we have and obtained. So if something doesn't resonate, we can honor that as well. If you have questions, you can always ask us and we will always help you out. Always, always. We want you to make informed decisions so you can pick the best possible products and best possible treatments for your clients. Critical thinking can be hard though, especially if you're lacking a little bit of confidence in the treatment room, if you're new or if you're a student, but utilize those that you trust and build upon your experiences. You might find the best answer within you.
Well, thank you so much for joining us today. We really appreciate it. For more information, like we said, check out your PDF version of your training manual.
Yeah.
You have those classes in the Learning Center. Go online and to our website, and you can find all of our classes that we have live in person. And we know the benefits of live in person classes. You get to ask all those questions. You get to meet other people
and make those connections.
So thank you so much for joining us. Have a wonderful day, everybody.
Bye.